Tendonitis refers to the inflammation of tendons, which are strong, collagen-rich connective tissues composed of hierarchically arranged fibers that link muscles to bones, transmitting force efficiently while providing flexibility. This condition often causes significant pain, swelling, stiffness, and limited mobility in common areas such as your shoulder, particularly the rotator cuff tendons, wrist, and ankle, including the Achilles tendon. Fortunately, a variety of effective natural treatments can help reduce inflammation, relieve pain, promote healing of these tendons, and restore your comfort and mobility, offering a safe, proactive path to recovery without immediate need for invasive interventions. Tendonitis commonly stems from overuse through repetitive motions like prolonged typing on a keyboard, using hand tools, or sports activities, as well as sudden injuries from lifting objects incorrectly. Additional risk factors include poor posture, gait issues, or underlying medical conditions that heighten vulnerability during repeated movements. One of the most crucial initial steps in healing tendonitis is practicing relative rest, which involves thoughtfully modifying or temporarily avoiding activities that aggravate your pain, such as overhead reaching for shoulder issues or gripping for wrist pain, while steering clear of complete immobilization to maintain some circulation and prevent stiffness. Ice therapy proves excellent for managing acute pain and swelling by constricting blood vessels in the early stages, whereas heat therapy excels at alleviating chronic discomfort by boosting blood flow, relaxing surrounding muscles, and easing tension in areas like the shoulder or wrist. Whether using ice for fresh inflammation or heat for ongoing ache, apply the therapy for 15 to 20 minutes at a time, repeating several times throughout the day as needed, and always wrap it in a protective towel layer to safeguard your skin from irritation, frostbite, or burns. Incorporating gentle range of motion exercises and stretching is vital for enhancing tendon elasticity, improving flexibility, and reducing stiffness over time. Examples include slow pendulum swings for the shoulder, careful wrist rotations, and controlled calf stretches for the ankle, all performed fluidly without forcing through pain. Eccentric strengthening exercises, where the muscle actively lengthens while under controlled tension, have been shown to be particularly effective for treating and rehabilitating tendonitis by stimulating tendon remodeling and collagen production. Gentle massage therapy applied around the affected tendon, not directly on it, can effectively reduce inflammation, loosen tight surrounding muscles, improve circulation and blood flow, and provide substantial pain relief through slow, circular motions on areas like the forearm or calf. Adopting an anti-inflammatory diet abundant in omega-3 fatty acids from fatty fish like salmon, potent antioxidants from mixed berries, and healthy fats from sliced avocados and leafy greens, such as spinach, actively supports tendon healing from within by combating oxidative stress and inflammation. Time-tested herbal remedies like turmeric, rich in curcumin for its powerful anti-inflammatory effects, and ginger for similar benefits, combined with supplements such as omega-3 fatty acids to curb pain and swelling, and collagen to bolster tissue repair, can further aid recovery. Consider topical castor oil packs for additional localized relief, always consulting a provider first. Acupuncture, a time-honored ancient practice involving fine needles placed at specific points, can significantly increase blood flow to the injured tendon area, calm overactive tissues, reduce pain signals, and enhance the body's innate recovery mechanisms for shoulder, wrist, or ankle issues. If you experience persistent, worsening pain, or any concerning symptoms despite these natural approaches, it's essential to consult a qualified healthcare professional promptly for an accurate diagnosis, to rule out complications, and to develop a personalized treatment plan tailored to your specific tendonitis location and severity. Always prioritize maintaining proper form and posture during any exercises to avoid undue stress. Gradually increase your activity levels as tolerated using a progress tracker, and attentively listen to your body's pain signals to make adjustments and prevent re-injury. By consistently incorporating these natural treatments, from rest and therapies to diet and exercises, many individuals successfully overcome tendonitis, returning to their cherished daily activities like gardening, playing with children, or brisk outdoor walks with renewed freedom and without lingering pain. Embrace these natural, evidence-supported treatments today. Take proactive, consistent steps towards healing and reclaim your full comfort, mobility, and active lifestyle with confidence and patience.